Hello again, and thank you for choosing to participate in my doctoral project. I sincerely appreciate the time and effort you are dedicating to this work. This week, we are going to focus on the costs associated with avoidable hospitalizations and explore both the financial and health impacts of preventable care. So first, we have to understand, why does this matter to us as providers? Avoidable hospitalizations are a significant concern in long-term care settings, impacting both resident well-being and the financial sustainability of healthcare systems. These hospitalizations often result from conditions that could have been managed within the facility, such as urinary tract infections, pneumonia, and congestive heart failure, according to Walsh et al. When residents are transferred to hospitals unnecessarily, they face increased risks of infection, medication errors, and functional decline. These disruptions can also lead to emotional distress, particularly for residents with cognitive impairments. From a systemic perspective, avoidable hospitalizations contribute to inefficiencies and strain on healthcare resources. Recognizing the importance of this issue is the first step towards implementing effective interventions that prioritize resident-centered care and cost containment. The financial burden of avoidable hospitalization is substantial. According to RTI International, Medicare and Medicaid spend approximately $1.9 billion annually on hospitalizations that could have been prevented with timely and appropriate care in long-term care facilities. These costs are not only a reflection of direct medical expenses, but also include the broader economic impact of extended hospital stays, readmissions, and post-acute care services. Reducing these unnecessary transfers through early intervention, improved communication, and better care coordination can lead to significant cost savings. Moreover, facilities that implement evidence-based strategies to prevent avoidable hospitalizations may also benefit from improved quality ratings and reduced penalties under value-based purchasing programs. So next, let's talk about the top 5 culprits and why early intervention matters. A small number of clinical conditions are responsible for the majority of avoidable hospitalizations in long-term care settings. According to Walsh et al., just 5 conditions, pneumonia, congestive heart failure, urinary tract infections, dehydration, and chronic obstructive pulmonary disease, account for 78% of potentially avoidable hospitalizations. These conditions are often manageable within the facility when identified early and treated promptly. For example, UTIs can be addressed with hydration and antibiotics, while congestive heart failure exacerbations may be mitigated through weight monitoring and medication adjustments. Recognizing these high-risk conditions allows for care teams to focus their efforts on prevention and early intervention, ultimately reducing the need for hospital transfers and improving resident outcomes. Early intervention is critical in preventing avoidable hospitalizations. When staff are trained to recognize subtle changes in residents' condition, they can initiate timely assessments and treatments that prevent escalation, like stop and watch, empower frontline caregivers to report early warning signs, while structured communication methods such as SBAR ensures that clinical concerns are conveyed clearly and efficiently per RTI International. Advanced care planning also plays a vital role by aligning care decisions with resident preferences, reducing the likelihood of unwanted interventions. Facilities that prioritize early intervention not only improve resident outcomes, but also enhance staff confidence and reduce overall burden on emergency services, according to both PaltMed and RTI International. So, as healthcare providers, what can we do? Long-term care teams can take several actionable steps to reduce avoidable hospitalizations. First, implementing early recognition tools like Stop and Watch enables staff to detect changes in resident condition before they become critical. This is what I like to affectionately refer to as things that make you go, Second, using structured communication formats such as SBAR improves the clarity and effectiveness of clinical handoffs. Third, engaging in advanced care planning, which I cannot talk about enough, ensures that care aligns with resident goals, reducing the likelihood of unnecessary transfers. Finally, educating staff about the facility's capabilities, such as on-site diagnostics, such as labs and x-rays, in addition to treatment protocols, empowers them to manage conditions in-house when appropriate. This education needs to go beyond the walls of the nursing facility, though. Educating specialists and hospital systems about the capabilities within these systems is imperative. These strategies, when integrated into daily practice, create a proactive care environment that prioritizes resident safety and quality of life. Thank you again for your time today, and I hope you enjoy my references.